Women complain of the pain in her left mammary gland, and the body temperature up to the 38.1 degrees Celsius. Examination shows that her mammary gland is enlarged, painful on palpation. The nipples is the edematous and has the fissure. The upper external quadrant of the gland is hyperemic. Name the measure that would have been prevented. That would have been prevented the development of this complication in the patient. So basically, this question belongs from the obstetrics. Okay. Now, going through this this particular type of question, how to approach on the fifth day after giving the delivery, there is a pain on the left. So if this it is a woman and it is the breast, so this is the two mammary glands. So mammary glands, and here the left mammary gland. So this one is the left and this one is the right. So in the left mammary gland, that there is a body that mammary gland and body temperature, there is pain. So on examination, mammary gland having the enlarged and painful. So just to visualize this, left mammary gland is enlarged and painful. So it is somehow enlarged and painful like this. Nipple is edematous, and there is a fissure formation, and upper external quadrant of the gland is hyperemic. Upper external quadrant means this one. This part is hyperemic, which is reddish in color. Name the measure that would have been prevented developing of this complication in the patient. Now, going for the approach, so given given complaint, so here we can see that the patient, that women must be following up with the that one feeding. Okay, so here in the given question, that is what happened if the feeding if feeding would have been on the time, because according to the obstetric parameters which I have discussed with you in the classes, that there should be, if it is feeding on schedule, if it would have been feeding on schedule, so there would be the problem with the symmetric way, but there is but in the given condition it is asymmetrical problem. Okay, now what measure that would have prevented the development of this complication in the patient? So there is something which has been already missed by the nurses or by the gynecologist or by the pediatrics. So how only one part will be affected? So there would have been the stop breastfeeding when fissure appear. So this could be the answer, but the thing is that a stop breastfeeding when fissure appear, that is not going to be the correct one, because what kind of things, what should be happen? So here fissure appears, and then how a mother will know which problem, because there was a particularly left side. So if one side of feeding will be given, or fissure appear only in the left side, so she would have given only right side of breastfeeding, that was also a problem. So this is not the correct answer. And the third one, the constant expression of the breast milk means consistently providing the breast milk. If it is a constant, so fissure will go for the fistula, and the problem may be the bigger one, that may cause a purulent infection as well, and there is a harmful or dangerous for the baby and the mother as well. Feeding on demand, expression of the breast milk, and prevention of the nipple fissure. This is not the correct obstetric parameters, because feedings cannot be on the demand, because obviously this is one social term which we say that when baby is crying, when there is some sort of signals, or we can say that we have some sort of schedule, but expression of the breast milk, that is not clearly observable and considerable. Prevention of nipple fissure, this can be the hygienic and healthy parameter, but not according to the our medical parameter. So that is also not correct. And the given option, the feeding not longer than 10 minutes, this parameter is defined by the WHO, and the standard one, the feeding that should no longer than 10 minutes through an overlay. This is the very important term which you should remember, that this line is given in the obstetric parameters. It is very very important that the baby should not be fed more than 10 minutes consistently from one side. What would have been happened? Now you can visualize the picture that what would have been happened. This women who have the baby, what she does that she consistently feed baby only with the left side more than 10 minutes. That results into the nipple edema, fissure formation, and the problem with the mother. So what will the management, if the question has been asked? So management is simply that there could be, you have to avoid, or there should some local treatment. We can provide some for the edema. We can give some like a skin friendly anti-allergic, or then we can ask him to go for the cold compress or the nipple tip, and that may result into the removal of the inflammatory signs. And you don't need to go for any kind of surgery, you don't need to go for any kind of persistent antibiotics, and you don't need to give any strong anti-inflammatory steroid. Okay, so it's absolutely like natural process, so it can be cured. Okay.